Suicide is a tragic and heartbreaking reality that affects countless lives each year. It is especially devastating when it involves young people. Did you know that suicide is the second leading cause of death for individuals aged 10 through 34? This alarming statistic reveals the urgency and importance of youth suicide prevention. So we will dive into the critical steps that schools, communities, and individuals can take to help prevent youth suicide, highlighting effective strategies and providing vital resources for those in need. Youth suicide is a complex issue influenced by a range of factors, including mental health challenges, social pressures, family dynamics, and social stigmas. Young people today face unique stressors that were unimaginable even a decade ago. From pervasive pressure and the impact of social media to the constant academic pressure, with mental health issues such as anxiety, depression, and trauma being more common than ever, we need a more effective suicide prevention strategy that is critical. Looking at some key statistics, suicide is the second leading cause of death among young people aged 10 to 34. In 2021, there were approximately 45,979 recorded deaths by suicide in the United States, and that's according to the CDC. For every youth suicide, there are numerous more attempts, with countless young individuals suffering silently, unable or unwilling to seek help. Addressing youth suicide is not just about saving lives, it's about creating a supportive environment where young people feel safe, understood, and valued. Preventive measures can help identify at-risk individuals early on, providing them with the resources that they need and to foster an environment that promotes mental wellness. By focusing on prevention, we can reduce the prevalence of suicide attempts and create a culture that openly discusses mental health and breaks it down so that we can break down the stigma and encourage others to seek help. Effective strategies for youth suicide prevention would be, number one, implementing a school-based prevention program. Schools are the most critical environments for reaching young people, and they play a significant role in the prevention efforts. Programs like Signs of Suicide, SOS, have demonstrated success in reducing suicide attempts and increasing the help-seeking behaviors. These programs educate students on recognizing the warning signs of suicide in themselves and their peers. So fostering a community of support and awareness is really the key. The second strategy would be promoting mental health education. Knowledge is power. Schools, parents, community leaders must work together to promote mental health education. This means going beyond the basics to ensure that young people understand the importance of mental health, recognize the symptoms of mental health conditions, and know where and how to seek help. Mental health should be treated with the same importance as physical health, starting with a comprehensive education at an early age. The third step would be to encourage open communications with trusted adults. Okay? So creating a culture of openness is vital. Young people should feel comfortable discussing their thoughts, their feelings, without fear or judgment or retribution. This can be achieved by training adults, including teachers, parents, and coaches, on how to communicate effectively about mental health issues, recognizing the signs of distress, and respond accordingly and appropriately. See, when young people feel heard and validated, they are more likely to open up and seek the help that's needed. The fourth step would be to create safe spaces. Establishing safe spaces within schools, communities, and online can provide young people with a sense of belonging, and it reduces the feelings of isolation. Clubs, support groups, and online communities focus on mental health, which can offer critical peer support, reduce stigmas, and encourage open dialogue. These spaces should be inclusive, welcoming, and staffed or moderated by trained individuals who can provide guidance and support. The fifth strategy would be to provide access to professional help. Access to mental health professionals is critical for effective prevention. Schools and communities must ensure that young people have the access to counselors, psychiatrists, and other mental health professionals who are equipped to provide support, therapy, and intervention as needed. In addition, telehealth services can offer more accessible options for those who may face barriers to in-person counseling. You see, programming makes a difference. These programs can make a difference. One notable example of the effective youth suicide prevention program is the Signs of Suicide, SOS. Program is implemented in the school. This program combines suicide awareness education with a brief screening for depression and other mental health issues, allowing for early identification and intervention. Research shows that schools implementing an SOS have been seen as significantly reducing the suicide attempts and increasing the help-seeking behaviors among students. Other programs like Youth Mental Health First Aid train teachers and community members to identify and respond to mental health crises, further expanding the safety net for the at-risk youth. So what can you do? Well, you can start by educating yourself and others. Learn the warning signs of suicide, such as withdrawal from friends and activities, drastic changes in their behavior, and then verbal hints about death or self-harm. Share this knowledge with others to build awareness. Then if you notice a young person exhibiting these signs of distress, don't wait. Reach out. A simple conversation can make a world of difference. Advocates for Change is where we want you to be by pushing for mental health programs in schools and communities. Support policies that promote access to mental health resources and education. Crisis helplines like the Suicide Prevention and Crisis Lifeline 988 are available and are invaluable resources. They make sure that young people know that help is available 24/7. That means at any time. And it's okay to ask for help. So youth suicide is a preventable tragedy. By implementing school-based programs, promoting mental health education, access to professional help, we can make a real difference in the lives of young people. Everyone has a role to play in prevention, from educators to parents to peers and community leaders. Together, we can create a future where young people feel supported, valued, empowered to seek help whenever they need it. And finally, if you or someone you know is struggling with thoughts of suicide or in need of immediate assistance, don't hesitate to reach out. Dial 988 to connect with the Suicide Prevention Crisis Lifeline. And remember, you are not alone. Help is available always. So let's work together to prevent youth suicide and create a safer and more compassionate world for all. By taking these steps, we can help protect our youth, promote mental wellness, and prevent the loss of young lives to suicide.